My name is Birgit Bauer. I'm from Germany. I'm living with MS since 2005 and I'm working internationally as a digital health and data expert. So I'm coming from a very different angle now. I'm a lot doing in ad boards and also steering committees. My last one is the OECD expert group on data free flow with trust. That means I'm in that group now and I can play a tiny role in that trust question, what we heard also here on already in the board. I coordinate also Data Saves Lives Germany, and I'm proud to say we're starting now the next project, the European Digital Health Academy. My focus today is simple: how digital innovation can help us to detect changes earlier and make our lives with MS much easier. And I have a personal example. It's this one. You know this. This is a smartwatch. And this is something I really appreciate in my life because I don't see my doctor so often. But it helps me to organize my days. It's invaluable for me. It says me, hey, your walking is not so good today. Maybe you should do a little bit more practice or sleep more. Or also it says when it comes to menopausal problem I experience already in my age, hey, it could be a problem too. And this is a very helpful tool for me personally, and I would say it's needed for many also women with MS, because we are all going older, unfortunately. As Victoria has shared, we need to know what's going on in our bodies. It's important to know why do I have numbness in my hand, or why do I have maybe a frozen half of my face, what I also have experienced already. Recognizes these changes in MS. It's not always easy, it's difficult. And we have a systemic pressure in addition. That means we have to wait to see the doctor. Sometimes the nurses are also not so available as we would need it. And this is a really big problem, I would say. And this is why I love digital tools. They are not magic. They are there to help us. Also, for example, AI can support us in analyzing our scans from the MRI, for example. In daily life, apps help us to monitor all this little thing is, and also to organize ourselves and also the disease management. Telemedicine can be a good part for those who are not so mobile. Do I need to go to the doctor at every time, or maybe I can clarify a simple tiny questions in a video conference, what is so much easier instead of going to the car, going to the doctor, going to the waiting room, asking my questions out of the 5 minutes. This is energy wasting, and I don't want to have that, to be honest. Also, in the future, I think we will have disease-specific GPTs in place to help patients when they Google their symptoms. So I would say at the moment, ChatGPT is the new Dr. Google, but we can do that better. And we have to do it better because there is a lot of misinformation, prejudices, and also incorrect information outside. And unfortunately, not every patient is digital savvy. That means digital literacy has to grow. We also have to say it will not replace the doctors. It will be a point to support us and the doctors to have a better conversation. This is, I would say, important, and also it's a bit more efficient. But we have also questions and regulations outside. I hear a lot of patients in my work saying, who is the owner of my data? What will be done with my data? And why? These are questions we have also to answer, and there are things on the way. I think it's a very ethical thing also for companies to say, so when we take your data, we do this, that, or maybe other stuff with that. Maybe there are some startups or newly companies outside collecting data from patients, doing maybe very valuable surveys or analysis with that data, but they have to communicate it. Patients have to know what's going on with that, and this is ethical. I would say we have the European health data space in Europe, and this is something what will bring us forward. We have different frameworks outside, and if you see the member states struggling with the challenges they have to do now, it's not easy. We have the AI Act as the world's first law about the use of AI outside now, but we also have to start already again to rethink about it and to do reviews about it, because there are open questions already existing. That brings me also to health data, PROs, and projects. Health data and PROs, as we heard from Anne, for example, are not just numbers. This is real-world data, and this is what we need to make sure the patients have the best care they can receive at the moment, or they can give to us. This plays a key role in that whole thing. I think as long as we have data, we can also move better forward. We can have a better research in that way. And that brings me a little bit to what we do in Data Saves Lives. Data Saves Lives Germany has a very easy aim. We are talking about health data. We explain it to patients. And also we are doing a lot of stuff to make it easier and to grow the awareness, the data awareness, or the data literacy, as I always say, in the patients. By the way, we brought out a magazine also to clarify the things a bit better to the patients. It was published in April, and you can download the magazine online from our website, www.datasaveslives.de. And we are moving forward. I said Data Saves Lives is nice, but it's not enough. So I designed the European Digital Health Academy also to grow more literacy. And in this case, not just the data literacy, also the digital literacy. It will be an e-learning tool, and it's going online more and more since today to make sure that patients can learn how can I use digital tools for my disease management, also for my organizing, and also to know more about it. How can I use it and what is behind? And this is an important tool for today, because we are living in a cultural change. We are shifting from the, I would say, conservative, traditional paper and pen culture to the digital culture. And I would say we have to do it together. This is not a problem of doctors, researchers, and maybe some experts, policymakers. It is a problem of us all. Means also patients. And when we do it together, we can detect changes in MS and also for our own much earlier. We reduce the uncertainty outside, and also we can share responsibility and leadership instead of carrying it alone. We should come out from the silos and come together on roundtables to make this world a little bit more digital and informative. I would say smart tools for smart tracking, not just to collect data, but to make living with MS more easier, more organized, and for all patients to support prevention too, because this is also what I heard today in one of the sessions. We need more prevention. So we need digital innovation today to make sure that care tomorrow is affordable, effective, and human. Thank you.